Good afternoon. And today we have a pleasure to interview uh, Mr. Michal Niedzielski. And he's postural physical therapist. And his interview is like a series of interview what I'm putting on our channel, how postural physical therapist, behavioral optometrist, and dentist can work together to resolve problems with the posture. And yes, our channel devoted to sleep, but as a dentist who work in the sleep area for many years, I noticed a lot of my patients have forward head posture, and they usually complain on a pain in the neck, on a pain in the shoulders. And over the history of our relationship, I know what a lot of them going through, hip replacement or knee replacement. And I was always puzzled with the question, why? And now we're going to find out some details from Michal on that. And also I want to mention thank you to our audience. If you like our channel and you have a problem sleeping or sleep next to the snoring partner, please click like or share button. This way you can spread the word. And if you're a medical professional and just like us, you're passionate about problem of sleeping and breathing in the same time, please use our channel as a networking ground. This way you can communicate with other medical professionals we feature, and only together we can put all the puzzles of this silent killer and find the solution. And again, welcome, Michal.
Maria, thank you very much for the invitation, and I trust that I can advance your message a little bit more. Yes.
Yes, thank you. And I would like to tell you a little bit more about Michal. Michal graduated with master degree in physical therapy in Warsaw, Poland in 1992. So he has a lot of experience in this area, and he has some personal story related to the choice of his passion. And now he has he works in a private practice physical therapy center of Horsehead. And if you have questions for Michal, you can put them in the comment box and we will find you the answers. And why he's different from a lot of physical therapists, he has a philosophy and he graduated from Postural Restoration Institute and he's certified in this area. And we'll find out what he does differently and how he look at the problems of the posture different. So now my story with Michal, we met at the dentist office, just like I met Samantha, Dr. Slotnik, and I met Michal in Dr. Tarada office, and thank you very much. What I had the opportunity to see how this team can work together to restore patient in balance, looking at the bite and looking at the vision and trying to level and put everything into good coordination. And I personally saw somebody who was falling on everyday basis, and when she came into that team care, she was able to walk straight and walk without losing her balance, and that was really rewarding to see. So Michal, my first question to you, how do you personally become interested in a postural restoration, and what's postural restoration? So tell us more.
Mhm. So, fortunately or unfortunately, I became personally vested very much in this, what I'm doing through several head injuries. And as you see in my head, there's a pretty large asymmetry. I had at least 12 head injuries, some of them pretty extensive. And I think so because of each injury, I noticed that I lost function. In a later my adult life, I was trying to find solutions for the lost function. So at the age of maybe 25, I was pretty not functional. I actually graduated from Academy of Physical Education in Warsaw, so I was pretty fit person. But at the age of 25, I really significantly lost function, even of driving the car. And if I drove for 1 hour and looked in the rear mirror, I had this horrendous neck pains. So I said to myself, I have to solve that issue. And I started studying really positions and postures and the relationship of the different complexes in the body to itself, and how that position or relationship is changing function. Um, should I go deeper to that?
No, no, I really like part of the story when you talk about the teeth. When you lost the teeth, how it
Mhm.
affect your endurance. I really think that's a fascinating story for me. And personally, I noticed I had a patient who, I do a lot of
Yes.
complex restoration and I restore posterior teeth. And I recently completed. And first of all, she used very distinctive words to explain to me what she feel when she chew now with both sides.
Yes.
And she also noticed what she feel more confident and maybe more balance in her steps. Like she got a little bit more mm, force, a little bit more power. What she can do the everyday activity, like she become maybe more balanced in a way. It's I knew about teeth being sensory organs for many years, but to hear it from somebody who doesn't have those knowledge, that was really rewarding. So tell us about your own experience, what happened when you lost some teeth and
For
how did
sure,
you
for
feel?
sure, for sure. So after my, I think so, one of the biggest injury was at the age of 4, and I watched a program about the scuba divers, and I took a long stick to my mouth, stand on the table, and I thought I'm going to swim through the room. We're in a theta at the, our brain operates in the theta mode at the time. So whatever you dream is reality. Unfortunately, my reality end up in the emergency room because the blood was gushing through my mouth. And the doctor says, he's to my mom, I remember that. He's going to heal. He'll be okay. And unfortunately, I'm still paying for that event because I never seen anybody. And at the age of 7, I already lost first tooth. I remember waking up myself from grinding and clenching the teeth at the age of 6, 7. So I lost my first molar at the time. The traumatic event was at age 14 when I lost the second molar. After until that time, I had incredible endurance. I could run with the much older kids and either be equal or beat them actually for the distance and for the short distances as well. But after the age 14, I lost that. I couldn't anymore run. So I almost subconsciously that bothered me, or consciously as well, very much because I lost part of my identity. And until right now, where I'm in the 50s, I'm still looking for it. And I think I'm very close to solve the problem. I finally understand the relationship of the occlusal plane, adic plane, ocular plane. And this is why you met me in a dentist office together with the optometrist. Okay.
Yeah, no, that this is wonderful answer. But now I want to bring back to our channel. How does bad posture affect sleeping and breathing? And I really like your metaphysical explanation because I find it, it's so close to my view on medicine in general. But we're not headless horsemen, so that everything is connected in the flow.
Mhm. I think so. The most important with our philosophy is that we can answer simple questions. I ask myself, for example, I look at the empty container and I ask myself questions, why does this container has a function? And the container has a function because it has an empty space. So it doesn't matter if this is a garbage can or this is the inside of our thorax. If you have a nice empty space, it means the air can go through it, or the fluids can go through it, or you can change position of them. The next question, you have to think about the pressure. So atmospheric pressure is approximately 14 and a half pounds per square inch. Average human body, if we average everybody, is close to 3,000 square inches. If you multiply this right now by that 14 and a half pounds, it will come close to 20 tons of pressure at any given moment on our system. And now you have to ask yourself questions. How do we sustain those forces of the atmospheric pressure, or for example, the forces of the gravity or ground reaction forces? And if you know answers for those, you will be able to see why people change their posture and why that posture for some people is so good or for some people is so bad. They simply cannot deal with those forces. If we will close our pharynx because of the forehead position, or from the bottom because we tip the pelvis forward, and that will create increased lordosis. That increased lordosis, um, maybe before actually will increase, will shift the entire upper body forward. And in order to keep the upper body forward with a vision parallel to the horizon, we have to increase the lordosis. Then the our shoulders will come forward with the head forward, and those will close the pharynx, and this resulting in forehead position with difficulties with respirations, with increased blood pressure, with problem with the hormonal control, with a problem with the digestions, with the GERD, and so on, so on, so on, so on. So practically, if you take any medical book and you read about the symptoms, those symptoms in my head are a result of a problem with the governing fluid or a gas. Okay? If we
Yes.
then understand how to change volume and velocity of the gases inside the body, entering the body, exiting the body, I think so you can have a good answers how to change the posture and the function of the system.
Yeah, this is a deep, very deep and beautiful answer, according to me. I would like to ask you, we all work on beauty. We want to be symmetrical. Some people use fillers, some people use Botox, some people use different, artificial touches to look symmetrical. So tell us, Michael, are we symmetrical or asymmetrical?
I remember seeing some video a few years ago. It was a very known dentist. He had some conference, and I think so. His name is Tom Colquitt. And if anybody want to Google that later, and he had a very funny video where he did transposing of his images to Tom Cruise and back from Tom Cruise to himself. I would love to transport this as well and be more symmetrical and be more beautiful, because this is those six social teeth over here where most of the dentists trying to address. However, the solution is not over there, because our system is inherently asymmetrical. We have a chiral symmetry of our hands. It means the left hand is really not what is right one. That can be put together in this way, but really the right cannot substitute the left one and vice versa. When you go to buy the shoes to the store, you all the time measure probably first one shoe because one leg is either wider or longer. If you buy the ring, you buy the ring for a specific finger and you cannot put that ring on the other side. Inside of our body, we have a heart, one stomach, one liver, and they position on the diagonal from the left shoulder to the right hip. There's practically every organ over there is asymmetrically positioned if they are paired, or we have just only one organ. And our digestive systems all twisted in certain way. Hemispheres are completely different on the right and the left side. Our vision is different, and we are tending more to recognize the space more on the right side and farther this farther space, close space with the right, farther space with the left one. So this entire system is asymmetrical. If I go to the conference for the optometrists, I ask them the questions. Can you see with both eyes and process at the same time? And the answer usually doesn't come very quick, but sooner or later I'll say you cannot because there's a chiasma. So if you take the information with your eyes, that information has to be reciprocal. Can you chew for the dentist on both sides at the same time? And most likely you cannot, because you have to move this food from side to side, and the mandible or maxilla above the mandible have to move. And for the movement people, I'll ask the questions: can you stand on both sides, on the both legs at the same time? And the answer is once again you cannot, because if you define standing as extension, adduction, and internal rotation, you can only do this on the one side at the time. And this is on purpose. We're designed like this on purpose because that give us a power because we can then torque ourselves. We can create the moment of the force, we can create a torque, and we can easily exchange energy from potential to kinetic, kinetic to potential, back and forth. If we will be without that asymmetry, then we'll be like boring landscape, then nothing will move. Then the snake will not have the way to weave through the landscape and not create a sinusoid. We are part of that environment, we're part of the energy, and our energy, we have to move like a sinusoid. And the sinusoid, I teach the exercises, people in exactly that. If somebody is to that level, I will show them where the sinusoid happens and how it happens in a triplanar movement with a triplanar action, because that's really what we are doing. We are create resonance, frequency, and rhythm.
So we are like creatures of nature, part of that.
We're the part of the nature. Exactly.
I
Yeah.
have a question, and it puzzled me. I have a lot of patience with the high blood pressure in my practice, and it's always bothering me. How do you if you see this similar problem in your practice? I'm sure you do. How what changes happened after your therapy with the blood pressure, and how you look at that problem from postural point of view?
Mhm. Many years ago, I was fascinating, and I'm still fascinated by Michelangelo. And I've seen this drawing by him where the diaphragm, especially the left part of the diaphragm, was descending and creating a vortex, which that vortex then was filling up the right ventricle of the heart. So I observe most of the people who come to my office, not everybody, but big part of the populations, that we have a tendency to be right-sided. And that right-sidedness will create you a more respiratory function of the right diaphragm, and that will create more postural function of the left diaphragm. It means the left diaphragm will be more flat and curving up. And most of the people can figure this out by touching themselves just on the lower part of the ribcage. If they feel that the ribcage is flipped up, it means the diaphragm is more postural oriented. And on the other side, actually, that Harrington Harrison groove won't be so big. That usually be lesser on the right side means your respiratory position over there. So if your diaphragm on the left side is not descending equally to the right one or even close, you're going to have problem with filling up the right ventricle. In my therapy, if somebody comes to me, in order to make them balanced, even in huge asymmetry, so we can reciprocate, so we can sleep, so we can rest, my goal is to change their habit for a up to the opposite direction, so the airflow can happen in different to the different empty spaces, and by that stimulate the left diaphragm so much that filling up the right ventricle will be effortless. And there's a big role for the dentist over here as well, because the cranium is inherently asymmetrical as well. Because of the straight sinuses, which are longer on the right side, we're going to have a, and I do not want to go too much too technical, so I'm trying to figure out the easy answer in that. We're going to have a different shape of the cranium, and the cranium will look like it's twisting inside a little bit to the left side, where the pelvis, because I'm motion guy, so I look at the pelvis, will twist a little bit to the right side. And that change of the shape will give us a tendency to stand on the right leg and touch mostly with the, or predominantly with the teeth on the right side. If you as a dentist can create more awareness between the molars on the left side, and me as a physical therapist can create more awareness standing on the left leg, following by you creating more awareness of the right canine, and me awareness of the pushing off from the right toes, then we just creating a little bit better action for the cardiovascular system. And in this way, we can help, not solve because I'm not a cardiologist, but we can help people with some forms of the blood pressure problems.
That's fascinating. And we're almost to the end of our interview. And I would like to ask you, how do you work together with the dentist, behavioral ophthalmologist, and you? Like, what problems you solve?
I work with a behavioral optometrist.
Optometrist.
Sometimes very difficult to talk to the ophthalmologists. I wish it would be easier to talk to them, but very easy to talk to the behavioral optometrists. Maybe if I can say how I found those people. I noticed for many years that I have a problem with certain patients. Those patients will look like me. You're going to have certain bow through the head, and that bow is very unfunctional. This is injury. This is one-on-one injury over here. And unless you know how to address this, those people will be very unfunctional. There will be a lot of chronic pains. There will be problem with sleep because there'll be problem with the airflow, velocity, and volume. And I was looking for those dentists with who first didn't have no ego and who could listen what I had to offer. And I found those dentists. There are plenty of them because
We
they're
interview one of them for sure on our channel.
you
Dr. Zelman
interviewing
was
me
there.
right
Yeah.
now, but you are the dentist as well, Maria, and you are incredibly interested with this as well. And you want to help people the same as I want to help the people. Just only with all those our licenses, we cannot answer all those problems. So we had to find each other because I cannot address the vision or organ eye, and the dentist cannot address the posture where I can, but I cannot address the bite. I cannot address the occlusal relationship over there. So we in that complex of cranium, cervical spine, and mandible and maxilla, we meet ourselves through the planes. I'm mostly governing the plane of the attic to some degree with the ocular through the structural position of the eyes, where the optometrist govern the vision based on the shift on the cranium, and the dentist governs this from the perspective of the occlusal. Much more for me, occlusal, it has a synonymous to the alveolar processes versus to the maxilla. So I govern this from the maxilla and sphenoid bone and the occiput, where the dentist from occlusion and the optometrist or neurooptometrist from the vision, so sensory information. And after scanning the patients, after evaluation, we are discussing our findings and we start seeing where is the biggest deficit. And we're usually trying to send the person to that clinician first. And if that will be the vision, the person will be sent to the dentist, to the
The
optometrist.
optometrist.
If there will be problem with the occlusion, with the bite or anything like this, the dentist will receive that person almost first. But I'll tell you honestly, it all the time practically I will start the work because that the rest of the system suffers so much.
Thank you very much, Michael. It was such a wonderful interview. And I would say it's like a beginning of a different view on the human body. And we're looking forward to discover more. Thank you.
Maria, thank you very much for having me and have a wonderful day. And thank you for your viewers to